Hello, my name is Kaylin Anders. I'm going to be performing a tracheostomy skill video today. First things first, I'm going to walk into the patient's room, introduce myself to them, let them know what we're going to be doing. I want to set them in a semi-Fowler's position, and I'm going to go ahead and suction their trach if need be, and then we can apply oxygen as well if they need that. So I do want to go ahead and wash my hands, do hand hygiene. I can't remember if I said that. And then I want to grab my tracheostomy care kit. We're going to take this. We want to remain sterile through all this. So open it using 1-inch borders. I have my gloves. I'm going to set them to the side. And then we do have our gauze right here that we're going to set everything on. We want to do, using the 1-inch border to stay sterile, we want to set this down, shiny side down. Perfect. Still using that 1-inch border. And then I want to go ahead and dump all my contents in here. Once those are dumped, I want to fill up this top basin with hydrogen peroxide and then the bottom two with normal saline, making sure that we are not touching the sterile field at all. And then I want to go ahead and put on my clean gloves. All right, now I want to go ahead and remove the patient's inner cannula, keeping the same curvature to make sure that we can put it in the same way when we're ready to put it back in. So I'm going to go ahead and put this in the hydrogen peroxide, let it soak, and then we're also going to remove this dressing. So discarding of that, and then after that I want to go ahead and take off my clean gloves. And then discard of those. I want to do hand hygiene, wash my hands, and now it's time to put on the sterile gloves. So using the 1-inch border, and I want to put this on away from the sterile field so we're not contaminating it. Okay. Away from the sterile field. I can go ahead and discard of this now. Perfect. So now I want to go ahead and clean the inner cannula. Okay, we're cleaning it, perfect. And then it still has the same curvature, so we're gonna go ahead and put that back in. Click it, make sure it clicks back in, perfect. And then I wanna take all of my Q-tips and put these into the normal saline solution. We're letting them soak for a little bit. And then I'm gonna take each of them and clean around the trach. We're just getting any of the crust, discard. Cleaning all around, discard, cleaning, discard, making sure there's no crust, cleaning, discard, cleaning, discard. Okay, perfect. So now we are going to go ahead and apply the fenestrative gauze around. All right, making sure that we're keeping the same curvature. And then everything looks good. And while I'm here, I do want to have my second tie ready to go. And then we are going to remove this first tie using the 1-step method. Discard of that old one. If I can get it through, sorry. You do want to make sure that we're holding their trach in place so that nothing's coming undone. Okay, perfect. So I got that. All right, perfect. So we have that on now. So everything is good there. And then I want to also take another piece of gauze and fold it into fours, into like a little thing of four, and I'm going to put this in between the patient's skin and the tie so that there's no skin breakdown. All right, and then I would take a piece of tape and tape that down. Sorry, the trig's kind of falling out here, but it doesn't stand very well. All right, so there we go. And then I want to, make sure that I tape that down. And then I want to lower my patient in the lowest position. And I'm gonna ask them if they need anything else. If not, we are all done. And I'm gonna remove my sterile gloves, discard. I would discard of all my supplies, and then finish up with some hand hygiene. And that is it. Thank you.